The Texas legislature will vote on thousands of bills every session. Often those debates can get overlooked, even on critical legislation. That's why we've asked legislators to come to TPPF to talk about their bills to make sure you stay on top of the most important issues making their way through the Capitol. This is The Layout. I'm Zach Whiting, Policy Director for Better Tech for Tomorrow, and today I'm with Representative Giovanni Capriglione. Representative Capriglione, welcome back to the show.
Great, thanks for having me.
So today we're discussing House Bill 3468, and this bill would give patients ownership of and clear access to their medical records. And you've been a champion in the privacy space for years, and this is another angle on it, health records. So what was the problem that you saw that needed to be addressed here?
Well, I mean, the reality is that most people assume that their health information is their health information. But what we've seen is that a lot of times their health information is being transferred from one place to another, can't necessarily access it. And so the goal of this legislation is to get that data. You have the right to be able to access it, but also make it more portable.
That's great. And and you touched on it a little bit, but specifically, what would your bill do?
Essentially, what our legislation would do is it would put the ownership of the data, just like in our privacy bills, would put the ownership of the data into you as the patient. You would be able to get access to it in the format that you needed, likely electronic or paper, but I'm personally contemplating mostly electronic request. And if the provider, whether it's the hospital, the doctor, whatever, doesn't give you that information, there's penalties for doing that. But of course, there's also, in some cases, a small payment that would be required if there's a cost to getting that information. There's already federal law that does this, but what we've seen is that that's not enforced as much as it could be or should be. And again, the opportunities to be able to have your own data provide significant value for the patient.
Yes, and so you talked about there's paper health records and there's electronic health records, and we see this sort of shift towards it. And as we sort of digitize, everything in our life, there are some that have concerns about increased privacy risks. So can you speak to some of those concerns, but also maybe the potential benefits of electronic health records?
Sure. And I mean, we have this conversation in a lot of different, I'm on the elections committee, and we also have a lot of conversations about paper versus electronic and so on. But the reality is a lot of your health records are already in electronic format. Think MRI, think CAT scan, think of so many different ways, especially when you're being transferred from maybe one provider to another. There's a lot of security, there's a lot of encryption, there's a lot of ways to make sure that the data is secure. At the same time, you want it to be secure and encrypted, but not hidden and unavailable to be used. So let's take, for instance, I have my data. With some of the tools that are out there, not only is it secure, but you can also de-identify and say, okay, strip out the part that talks about it being me specifically, and now maybe I want to go shopping out on the market. I want to look for an insurance product that's best for me, or I want to find a doctor or somebody else that, given my particular health needs, I would find the right person. Couple that with data about what your insurance is, you'd probably be able to find the best for the least and the least impact. And so to me, being able to have that information, again, de-identified, in some cases secured, another, really helps with the competitive landscape of health.
Yeah, that's great. And since you've introduced the bill, what kind of feedback have you gotten from constituents and colleagues and others?
I've gotten a lot of positive feedbacks on it. I guess, it's a pretty good law when people say, how is that not already the law, right? That you have access to it. There are some folks, obviously, some industries where they make money off of holding onto your records and selling your records. But having it somewhere else brings upon cybersecurity risks as well. Having it somewhere else provides privacy risks. Some of this data is being used by some of these big companies to train artificial intelligence engines. And so they're making money, they're making profits, they're learning a lot about you. I think we should all have the right to say, that's mine, it's private, I want to keep it.
Very good. Well, thank you again for joining us today.
Great. Thanks for having me.